Kawasaki disease. I handed out the pamphlet I got off the Kawasaki Disease Foundation website. It's got a lot of information that I'm going to go over today in this little pamphlet. So, Kawasaki disease. It was first written about by a pediatrician, Mr. Kawasaki, in Japan in 1967. In 1976 was the first case in the United States in Hawaii. The condition, it causes inflammation in the walls and small, medium-sized arteries throughout the body, including the coronary arteries. Kawasaki disease is also called mucocutaneous lymph node syndrome because it also affects the lymph nodes, skin, and mucous membranes inside the mouth, nose, and throat. Kawasaki disease is usually treatable, and most children recover from the Kawasaki disease without serious problems. Now there are you need to treat Kawasaki disease within 10 days of onset. Now this greatly reduces the chances of lasting damage. Now some kids, it comes and goes, and their parents, they're not even aware they even had it. Some cases it gets worse, but I mean, we'll talk about it a little bit more. KD is the leading cause of acquired heart disease in children. About 1 in 5 children with the disease develop heart problems, but only a small percentage have lasting damage. No one knows what causes Kawasaki disease, so if you don't know the cause, then we really don't know what to say to help people prevent getting the disease. Now, there's 3 things that are known to increase your child's risk of Kawasaki disease. First one is age. It seems like more children between the ages of 2 and 5 years old are most at risk of getting the Kawasaki disease. More boys than girls tend to get the disease, and also people living in Asia or Asian descent, such as Japanese or Chinese, have higher rates of the KD disease. Now Kawasaki disease, it seems like it has 3 phases. I'm going to actually read these to you. The first phase, high fever for 4 days or more, extremely red eyes without thick discharge, rash on the main trunk and in the genital area, red, dry, cracked lips, and extremely red, swollen tongue, also the strawberry tongue, swollen red skin on the palms, hands, and soles of feet, swollen lymph nodes in the neck, perhaps elsewhere. Now phase 2 may develop peeling skin of the hands and feet, especially the tips of the fingers and the toes, and it's often a large sheet. I mean, you'll know it. It's gonna be pretty gross. It just peels off. Joint pain, diarrhea, vomiting, and abdominal pain. Now there is a third phase, and this is what I was speaking of earlier. The signs and symptoms slowly go away, or unless really bad complications develop. And so, let's see. Now there's also atypical Kawasaki disease. Now this is where it starts getting tricky. Your child may only have a few of these signs and symptoms. They might not develop the classic case of all these phases, so they still have the disease. Now, there's no specific test available to diagnose the Kawasaki disease, so really you're just rule out of elimination. But that brings me to back in December 2008, Brian Luttrell, you probably know him from the Backstreet Boys, his little 6-year-old son, Bailey, had Kawasaki disease. When they first went in, they thought it was just like herpes, and they treated him for that, and then he got another symptom, they took him back, and they went through thinking it was like 4 different things before they finally figured out it was Kawasaki disease. Now this was December 2008. A month later, January 2009, that's when John Travolta's 16-year-old son Jet died. Now, he died of a seizure, but he had Kawasaki disease when he he was 2 years old. So there was a lot of talk about the Kawasaki disease. Now, like what I was saying, there's not one test to say, hey, this is Kawasaki disease, but they can do urine test, blood test, electrocardiogram, the echo, and this helps determine what your child may have. At first, it could look like scarlet fever, it could look like Stevens-Johnson syndrome, toxic shock syndrome, measles, herpes, Rocky Mountain spotted fever. I mean, I can keep going on and on. Sinus infection. So, anyway, the treatment. The goals of initial treatment are to lower the fever and inflammation and prevent heart damage. If you can catch this early, let me try to say this right, gamma globulin, go ahead and give that to them. And this is the rare exception where you want to give children aspirin. High doses of aspirin may help prevent clots from developing. Aspirin can also decrease pain and joint inflammation, as well as reduce the fever. Kawasaki treatment is a rare exception, once again, to the rule on using aspirin in children. After the initial treatment, once the fever goes down, your child may need to take a low-dose aspirin for as long as 6 to 8 weeks or longer if he or she develops coronary artery aneurysm. Aspirin helps prevent clotting, a little repetitious there. And if your child develops flu or chickenpox during the treatment, immediately stop the use of the aspirin. Now, without treatment, Kawasaki disease lasts an average of 12 days. Through heart complications may be evident later and be longer lasting.
The coronary arteries are the blood vessels that supply oxygen to the heart muscle. Because the heart muscle is always contracting, it needs a steady flow of blood to bring it nutrition and oxygen. When children develop Kawasaki disease, the walls of these arteries become inflamed. If we could go inside the blood vessels, we might see something like this. Normally, a cell layer called the endothelium protects the vessel wall and prevents blood cells from leaving. However, some trigger during the development of Kawasaki disease causes the endothelial cells to become activated and causes cells of the immune system to stick to the endothelium and leave through the blood vessel wall. Inflammation in the vessel wall is caused by immune cells gathering in the wall and liberating chemical signals that recruit more cells and further damage the vessel wall. Intravenous gamma globulin, or IVIG, interacts with these cells to quiet down the immune response, although the exact mechanism of how this is achieved are poorly understood. When inflammation occurs in the vessel wall, it causes the artery to dilate. About 1/3 of children in the early or acute stage of Kawasaki disease will experience dilated or widened coronary arteries. If the patient is treated with a protein solution called gamma globulin, or IVIG, within the first 10 days after fever onset, the chances of the dilated artery returning to normal size without scarring are excellent. However, if the inflammation is treated late, or the IVIG infusion is not effective, permanent damage can occur to the arterial wall. Sometimes this results in a ballooning out of the wall, called an aneurysm. This ballooning of the vessel causes the blood to swirl and increases the risk of blood clot formation. If the blood clot continues to grow, this may result in blockage of the vessel and a heart attack. In many cases, scar tissue will begin to form in the aneurysm over time, and the blood vessel will heal. However, the blood vessel is never again completely normal, and many years after Kawasaki disease, scarring could lead to narrowing of the vessel and again present a risk for heart attack.
3.